for retroperitoneal hematoma. All right. So anytime you see hema, all right, is it hemoglobin? Anything hem, you are talking about blood. All right. So now, what is the word retroperitoneal? Anything retro is behind. Peritoneal is peritoneum. All right. So if you are saying retroperitoneal hematoma, we are simply looking at what? A collection of blood at one part of the body, all right, and that's behind the peritoneum, or you could say behind the abdominal cavity, all right. So let's look at it. We'll be looking at this condition and we'll be looking at the definition, look at the causes, look at the symptoms, look at the diagnosis, look at the treatment, look at the complications. Then we'll have a summary on all the facts and all that. All right. So retroperitoneal hematoma, also known as what? Retroperitoneal hemorrhage. Okay. Retroperitoneal hematoma is a collection of blood in the retroperitoneal space. Right. Now, this is an area behind the abdominal cavity. Right. And it can be caused by various factors. Now, we move into the factors. Now, for blood to actually collect, can you see there's collection of blood here? All right. Can you see here there's collection of blood here? Okay. For blood to actually collect there, one of the causes could be due to a trauma. Like somebody had an accident, car accident, the person fell and all the stuff, right? Trauma. The surgery, it could be an abdominal surgery or any back surgery. Bleeding disorder, it could be due to what? Hemophilia. All right. Hemophilia is some disorders that the blood is not clotting again, or is not clotting fast. All right. So this bleeding can bleed from anywhere and actually collect in the retroperitoneal space, because the retroperitoneal space is what? A dependent space. Okay. It could be vascular disease like what? Aortic aneurysm. It could be as a result of tumor or cancer. It could be just spontaneous bleeding, which is rare. Okay, but it's mostly due to all those disease conditions that affect your clotting factors and all that. Symptoms. If somebody has a bleeding collected in the retroperitoneal space, how would they present to the clinic? So they might complain of what? Abdominal or back pain. There could be swelling or tenderness. There could be nausea or vomiting. There could be fever, right? Low blood pressure, decreased hemoglobin levels. That's where you actually take a test of it. Right. Then diagnosis, like if you want to confirm that this disease condition actually what exists, you might want to do things like imaging studies like CT scan, MRI scan, ultrasound, just to confirm. You could do blood tests like for hemoglobin, platelet count. You could also do what? Physical examination, where you do all those abdominal palpations and all that to know which side the patient is feeling pain and all that. Okay. Treatment. Fluid resuscitation and blood transfusions, surgical interventions like what? Laparotomy or angiography. Alright. Then endovascular procedures like what? Embolization. Alright. Trying to stop the bleeding. Then you could manage the pain, you could monitor and do supportive care. Alright. Complications now. Alright. It could lead to what? Too much bleeding will lead to decreased volumes of blood in the body. That's hypovolemic shock. Now, if there's decreased volumes of blood in the body, it could lead to organ failure. All right. It could lead to what? A decrease, not really decrease immune system. There's wound there, so it could also be like a portal of entry for these microorganisms. Okay. So you're having a wound there and the infection can occur. There could be abscess formation. There could be chronic pain or disability. All right. So you can see this is what? Retroperitoneal blood. All right. So for retroperitoneal, it's actually difficult to diagnose, but watch out in patients with hypotension, but no retroperitoneal sign, following abdominal pressure, and no abdominal trauma, and no obvious source of hemorrhage. If you know that the patient had an abdominal trauma and their temperatures, not temperature, the blood pressures are kind of like going low, that's hypotension, you watch out for them, all right? And the tenderness can be mass. in the flanks. All right, so you check for the right and left flank just to pick it up, right? So I think that's it for what? Retroperitoneal hematoma, or the concept of retroperitoneal hemorrhage.